Sunita.
So assessment of pelvic floor is very important. And assessment, we need a detailed patient history, patient reported symptoms, outcomes. We will decide that what is the problem after going through the forms, and information gained from all the clinical signs and all these investigations. And after that, we will come at the one conclusion that what talk we have to do with our patient, what will be the conversation topic. Final outcome of the problem of this problem will be from this detailed history. And after that, we will give her a counseling, and then we'll ask, we have to go for observation and assessment. Many things are going to come into the assessment and observation, but some important thing, which is very important, giving the patient detailed understanding of her problem, what is affecting her. So detailed understanding of that particular problem, that why it is into her case, what can be the causative factor, and detailed understanding of problem, detailed understanding of pelvic floor, and understanding of you also. Introduce yourself with your patient that I have dealt, and she's not only one person who's suffering from this issue. There are many female, there are many patients, and they are coming to you. So try to give that kind of understanding also. So it is not only her who's going through the problems. So give her assurance that yes, pelvic rehab therapy can help her. And if you found that it can help her, so give her understanding about pelvic floor and what is our assessment and how we are going to go for assessment. Give her all the possible steps, like how we are going to take assessment. The first thing is, after taking this detailed history, we will tell her that this is a pelvic floor muscles. Then we'll tell her, okay, this is the urine incontinence problem. So in her case, how pelvic floor muscles can cause this problem. After that, I have to check you. I have to check your muscle strength, muscular strength first. And for this, I need to see the strength of your pelvic floor, and these muscles are lying inside the body. So I need to do trans-vaginal and trans-rectal assessment of the muscle. And for that, you have to come, you have to like lower your clothes and then lie down in a couch. And in that couch, I will observe the external structures. If there is any problem, I will let you know. And then I'll check the pelvic floor muscle strength by inserting my finger inside. So are you comfortable? Can we proceed with this? Without checking your strength, we will not be able to make you your muscles understand. We have to see the strength. Or can we help you, or pelvic floor rehab therapy is for you, or I have to refer you to someone else. So let me check your pelvic floor. And then after giving this understanding, we will also tell her that someone can be with us, our assistant, or she can also take her family person if she want to take a family person. So someone will be there, and we are taking your assistant. So introduce your assistant with the female and make her comfortable, and then take her to the room. Ask her to lie down and cover herself with the sheet provided. So you have to provide her sheet and ask her that she can remove the lower half and she can cover herself, and give her an appropriate position to a patient. Make sure once the patient is inside the room, assessment room, the room should be completely confidential room. There should not be any CCTV, any other recording access. The room temperature, the lights should be on the perineum, and it should be, you have to maintain the privacy of your patient. There should not be that kind of room where anyone can come. It should be only a procedure is going on, so nothing should be able to come inside. Make sure that you have all the necessary things which is you require for the assessment, that should be in that room. So basically what we need over there is gloves. We need gloves, we need the sanitizer, we need tissue papers, we need some wet wipes, we need some gel, we need some oil. So there's a list of 5 or 6 things which we require as a physical therapist. There should be enough light over the perineum, so you can see the perineum area comfortably. So, and you should also have some other arrangements, like dustbin should be there, and there should be like all the things. When you want to record something, you might want to show something to your patient, so there should be one handheld mirror so you can show to your patient. So those kind of small things you should have. The first is gloves, sanitizer. Third, you also should have some condoms, tissue paper, wet wipes, physio gel, or any lubric gel, because you are going to touch the area. There should be some cotton buds, earbuds, because there might be sensitive area in around this vestibular. So like vulva is there, or the Bartholin glands are there. If there is something you want to see, that if there is some inflammation is going on, so you should have all these small full. And we will ask her before proceeding, we will ask her, is the bladder full? If she's saying no, the bladder is not full, so we'll give her a lot of water to drink, because we want her bladder to full. So while we will do the assessment, we want to see the behavior of leakage, and that we will always only going to understand once the bladder is full. Okay, so in case of hypotonus pelvic floor dysfunctions, prolapse, incontinence, all these cases, we want our patient, she should have bladder full. The other side, when our patient is telling us that she has a chronic pain, she has a pelvic pain, vaginismus, dyspareunia, constipation, hypertonus pelvic floor dysfunctions, in those cases, we don't want unnecessarily any strain over there, because we want to see the relaxation capacity of the muscle. So in this case, we will ask her to empty the bladder, or if we will also ask her if the bladder, she passed her stool this morning or not. And is she feeling like passing the stool, so she can go and pass the stool before your examination, before the assessment. Clear? The passing the stool or urine is very important thing for your assessment. In case of hyper, we don't want bladder and bowel full, and in case of hypo, we want bladder full. Okay, just to see the what is going on, how the muscles are able to hold this area. Assistant should be present, bladder empty or not, as per the need of the examination, means hypo or hyper. As per that, we will take that call. And if it is not filled, we'll give her a water, she will drink her water, and we have to wait up to that moment. Once she will she will tell you that my bladder is full. So bladder is full, so now we can go for assessment. And for this assessment, we always going to have we know that we are going to always use that gloves and lubricated finger.